Hai, saya Ira dari Lavender Medicare. Hari ini saya berada di Mount Elizabeth Medical Center bersama Dr Mizan Marican. Dr Mizan adalah seorang ortopedic surgeon. Dr Mizan sangat lancar berbahasa Indonesia, jadi untuk yang mau berkonsultasi dengan beliau akan sangat mudah. Dr Mizan, based on your experience, why do people have hip pain and at what age do they have it?
There are many reasons why people get hip pain. In the young, they may have fallen down, they may have had a sports injury, or they may have just sprained their hip. In a slightly older age group, they can have all the above mentioned, but they can also have common conditions like a labral tear, for example. They could also have a condition called avascular necrosis, where there's inadequate blood going to the hip joint. And because of that, the ball of the hip crumbles and dies. But there are many reasons why someone might get avascular necrosis, or AVN in short. So the most common causes include high alcohol consumption, high doses of steroid consumption. Sometimes they may have it because they're on certain medications, cholesterol medications, chemotherapy medications. Patients who get involved in deep sea diving, they may also get avascular necrosis of their hip. But more commonly, due to age and wear and tear, they may get osteoarthritis of the hip. And this is basically wear and tear of the hip.
What are the symptoms that patients presented when they come and see you?
Well, some of them don't tell me they've got hip pain. Some tell me they've got back pain or buttock pain. Or actually they just feel that their legs are not the same length. They may have problems putting on their socks, their underwear. They might have trouble sitting on the floor. Some have problems praying. The Muslims pray, they have to stand up, they have to sit, they have to almost squat. Some have problems just cutting their toenails. So they may not come to me with hip pain, but I'll have to draw it out of them that it's the hip pain causing all these symptoms that I've described.
What are the treatment plans for these patients?
When a patient comes to see me with all these symptoms, I do assess them as a whole individual. I have to assess for back pain, knee problems, foot and ankle instability, and then focus on the hip. During my clinical examination, I'll determine whether the patient actually has a muscle sprain or whether it's a deep-seated arthritis that's affecting them. After all those investigations and assessments are done, we'll then sit down and discuss what we found, and I will lay out all the treatment options for them, including non-surgical treatment such as medication, physiotherapy. If they have legs which are not the same length, we add in an insole in their shoe just to get the lengths equal. For those who have failed those conservative treatments, I would offer them injections into the hip joint or even their knee joint, and that helps them reduce the pain and disability that they may have.
What type of surgery is available for these patients?
If they have a mild sprain in their hip, they may just have physiotherapy. If they're young and they have a labral tear, we can do keyhole surgery or minimally invasive surgery to sew up the labrum, and this is part of hip preservation. In patients who are 50 and younger, we try and preserve their hips as much as possible, whereas those who are 50 and older, most of them have arthritis of the hip, so preservation may not be the best option for them, and in that particular group of patients, I may elect to do a hip replacement instead.
I heard there's a new way of doing a hip replacement. Can you elaborate?
Yes, of course, yeah. Hip replacements are one of the most successful surgeries in orthopedic surgery, and we've been doing it for decades and decades. And traditionally, we perform a hip replacement once the hip is worn out. And so if I could just draw your attention to this particular hip right here. So this is a normal hip. It's a ball and a socket joint. And there's also a sort of a rubber lining around the socket in red, and it's called the labrum. And what it does is that it increases the stability of the hip and allows fluid or synovial fluid in the hip to be spread evenly. Moving on to a hip that's probably 40 or 50 years old, you'll start to see the head start to sort of be a little bit irregular. The cartilage starts to crack and have dents and divots in it. If they have just a labral tear in the front, they may have groin pain, especially when they cross their legs or put on their clothes. For those patients who have hip arthritis, where the ball and socket are worn out, their pain may be a bit more deep-seated. It may be in the front, side, or back of their hip, or they may just say, I've got some pain in my buttock or even my thigh. And for those who are in their 50s and above, we expect them to have some wear and tear in the hip. So a hip replacement is a successful operation, and it involves replacing the worn out parts of the hip with implants. These days, modern day surgery, we want patients to walk on the same day of their surgery. We want them to have a high quality of life. We don't want them to have any hip precautions. We want them to live freely. The modern ways of doing hip replacement surgery, we tend to enter the hip through the front. And the benefit of it is that you don't cut any muscles, you preserve all of them. You merely push them to the sides, and as you do your surgery, you don't cut any muscles at all. After the surgery, the muscles are allowed to come back to its original position, and it allows patients to maintain their strength in their legs, their confidence in their walking, and they get back to activity faster and with less pain.
What can we do to prolong the lifespan of the implants?
Over the years, the manufacturing process of the implants have surely improved, and that has increased the longevity of these implants. Firstly, the implants are made of several parts. On the stem, you can see the stem itself with the neck made out of metal alloy titanium. The head can be made out of ceramic or metal. And the socket itself, the part that's attached to the bone, is titanium, and the inner lining is either made of ceramic or polyethylene or plastic. So the hardest combination would be a ceramic on ceramic, and lots of surgeons use it, and it lasts a long time. But there is a small risk of squeaking sometimes. So we use normally ceramic and polyethylene so that it lasts just as long without any risk of squeaking.
Can they go back to doing sports after hip surgery?
There are many sports that patients can participate. Some are aerobic sports such as cycling, jogging and swimming, and those are absolutely fantastic for these patients because they're good for their cardiovascular, and they're not high impact sports which will shorten the lifespan of these implants. Contact sports, maybe rugby, football, basketball, those are not really good for the longevity of the implants. Endurance sports as well, like marathon running. Those sort of endurance sports will probably wear out the implants faster.
But at least they can live their life free of pain and do their normal activity.
My main focus is to make sure that their quality of life and their basic daily activities, including work, is taken care of. It also improves their mental state and reduces their level of anxiety.
How do we maintain the health of our hip?
Regular aerobic exercises to maintain the flexibility and mobility of all your joints, not just the hip. So you have to make sure that your spine is supple, your knees are moving well. What's very important is that you strengthen the muscles around your joint. So going to the gym to do moderate weight, it doesn't have to be a very heavy weight, but a moderate weight will help to increase the strength of the muscles, and that helps to protect the joint.
Thank you so much, Dr. Mizan, for the information. It's really life-changing if you can have your good quality of life throughout your lifespan.
Absolutely. Thanks for having me.